If your breath smells like fruit, your body could be in danger. And if your urine smells like sweat, it might be a silent killer. These weird smells aren't just embarrassing. They could be your body crying for help. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at some of the weird smells that come from our bodies. And this could be early signs of diseases, and we should not ignore them. Generally, our bodies emit smells, and this is natural. The smells could be from the sweat, and it could be from any of the body excretions like urine or stool. They have some characteristic smell that is natural to them. It is when these suddenly change, then this could be a signal that something deeper is happening. So today we are going to look at some of the strange smells that you cannot ignore because they could be signs of deeper problems that are affecting your body. So stay to the end so that you learn which smell could be actually predict your cancer early. We have the fruit smell, which could be diabetes. A sweet or a fruity breath smell could be an indicator of diabetic ketoacidosis. This is an acute complication of high blood sugars that makes your breath be faster, and then the breath is fruity smelling. And this is a life-threatening condition if undiagnosed or poorly managed, can lead to death very easily. So it is common in type 1 diabetes, especially comes with severe dehydration. And we ask if you notice someone has a fruity smell and is confused or vomiting, go to the hospital immediately. This could be an indicator of diabetic ketoacidosis. That person's life is in danger. Then we have sweet or strong smelling urine. Could this be diabetes or a liver problem? You have sweet smelling urine. Diabetes or maple syrup urine disease in rare cases can present with sweet smelling urine. Ammonia-like urine could be a sign of dehydration or liver or kidney diseases. Sometimes in urinary tract infection, the smell of ammonia might be obvious from urine. Or if you have your liver is compromised, then you have your urine color changes to yellowish, and it has a characteristic smell that accompanies. So if you notice this, you need to increase your hydration, you need to test your blood sugar, and you need to ask medical attention so that you can be assisted to know what could be happening. You have a rotten feet or cheese-like smell from your feet. This could be a sign of fungal or bacterial infection. Arthritis foot or bacterial overgrowth on your skin in the feet cause a pungent smell, which is very discouraging and can be very pungent. If you have long standing cases, this could be a sign of weakened immunity or poor circulation to your limbs. And this is more so if you have diabetes. So it is important that you emphasize hygiene. You always check the coloring of your skin in the lower limbs, and also check your blood supply. And if you have fungal infection, then it is important that you get treated, especially in diabetes, because this fungal infection can lead to secondary bacterial infection. and this can lead to serious bacterial infection of your feet, which can lead to death due to serious infection, or your limbs are getting amputated. And you have these smells, and then your feet are darkening. This could be a sign of poor blood supply in your feet, and you need to see your medical provider immediately. If you have garlic or fishy body odor, this could be some of the conditions that have problems with the metabolism of something we call trimethoprim, which is an amino acid in the body. And if it is not metabolized lightly, then you have this garlic or fishy odor from your body. So it is a rare condition, but when you have this kind of smell, it is a warning sign from your skin or from your breath or from your urine. And this, you need dietary adjustment. You also need to see your medical provider to help you manage this condition, which is a metabolic problem. You have foul smelling stool unusually. This could be a sign of gut infection or celiac disease. Exceptionally, foul smelling stool or sour smelling stool would be pointing to malabsorption, a condition like we call celiac disease, or you may have condition we call irritable bowel disease. It could also be a sign of infection, especially with some bacteria and protozoa, like what we have Giardia infection. You may also have Clostridium infection. So if you find that your stool is smelly, is floating in a toilet bowl, or is oily or light colored, this could be your gut giving you signals that your absorption is not all right and you need to seek attention. You have bad breath from your mouth. This could be more than just dental issues. Not always about blushing, but it could be a signal for liver failure. When your liver is failing, then you have an accumulation of bilirubin, you have discoloration of your mouth and your tongue, and this could come with abnormal smell from your mouth, what is called fetal hepaticus, which is a sign of liver disease. Then you have kidney failure. When you have a kidney failure, there is an accumulation of ammonia in your body. And when you have accumulation of this ammonia, then you have an ammonia breath right from your mouth. And this could be your warning signal that your kidney could have failed. Then if you have any problem from your gut, then you have this persistent regurgitation of gas from your stomach. And when this happens, then this could be a warning sign that all is not well from your gut. So persistent bad breath, then you need to check beyond the mouth and think, could you be having something else that is life threatening? Then you have unusual vaginal odors, which could be a sign of infection or even cancer. If you have a strong fishy odor, it could be bacterial vaginosis. Bacterial vaginosis is a common vaginal infection, and they usually present with a purulent discharge from your private parts. Then if you have a metallic or foul smelling discharge from your vagina, it could be a sign of cervical or vaginal cancer presenting with this foul smelling discharge. So it is important when you find this that you use regular screening so that you can diagnose early cancer early, and you can also be treated before the complications are set in. So when you notice these abnormal smells, what do? Do not panic. That is the first thing. Know that your body is giving a signal, and then do not ignore. Do not wish it away. If you see the smell is persisting beyond 48 hours, then track when, how often, and any other symptoms associated with that smell, and report it to your health provider. See your doctor early, and these smells might be what will save your life and prevent serious complication if taken seriously. So your body speaks, and it speaks in different languages. Sometimes it is in whispers, and sometimes it is in smells. So don't silence the signs. Listen, investigate, and act. You might just prevent a health disaster by just acting on some of the smells that could be coming from your body. I encourage you that if you have these weird body smells and you are wondering what is happening, share your story. And also, if you have had your disease diagnosed by these weird body smells, let's know how the experience was so that we share the experience so that we all know how to make diagnosis from the smells that come from our bodies. I also encourage you that if you have noted any of these weird smells, to know what they mean and more tips on how to stay healthy and to recognize more signs of diseases, subscribe the Overall Health YouTube channel for more tips. Remember also to make your tips and your comments on some of the experiences that you have had with body odors. Thank you for watching, and we meet in the next